and greetings to friends and lecturer. So today I want to present about the introduction of consciousness. Consciousness is a state of being aware of an external object or something within oneself in our surroundings. In easy words, we are alert and respond to our surroundings. It consists of all sensations like hearing, seeing, tasting and moving. Also perception, memories like what we remember of the last time, what we did, and also feelings like what we feel on that time. Moving to the level of consciousness. So level of consciousness consists of two levels, which is first is a normal waking consciousness and the second is a altered states of consciousness. The first one is normal working consciousness, which consists of two parts. First is conscious, which is we are alert and response to our surrounding, and the other one is unconscious, which is a deficit and altered in our consciousness. On the second part is altered states of consciousness, which will be presented by my friend. Body part that important for mind consciousness is first thalamus and cerebral cortex, which is causing a loose self-awareness and even we still awake if it is damaged. And the other one is the brain stem, which is important for certain involuntary system like breathing and heart beating, and will cause a comatose and will make us in a coma state if it is damaged. Now let's introduce to some of the theory in consciousness. Firstly, the Barr's Global Workspace Theory in 1988 said that the function of consciousness is to broadcast information to separate and functional of modules throughout the brains. Secondly, the Dennett Multiple Drafts Theory in 1991, which states that consciousness is not at all or nothing phenomena occurs at the same time, and he refused that consciousness is not some kind of theater in life. The third is Shannon Theory 1948 states that the consciousness consists of three distinct components, which is sense being, mental awareness, and reflection.
Thank you, Mohamad Azamul Aniq. My name is Noor Fahiezah binti Mahmud and my matrix number is 73661, and I'm going to present Introduction of Altered State of Consciousness. So, let's begin. Do you guys know what is an altered state of consciousness? An altered state of consciousness can be defined as a temporal change of one normal mental state and emotional experience. It can exist both on the lower parts of continuum, which is during reduced awareness, and the upper parts of continuum, which is during heightened awareness. An altered state of consciousness can be induced by various types of medicines, hypnosis, or taking psychoactive drugs. Characteristic of altered state of consciousness. These following characteristics help to determine whether someone is experiencing normal waking consciousness or under altered state of consciousness. So the first one is emotional awareness. During an altered state of consciousness, the way emotions are experienced is often different. It can be more or less instance of controlling emotions and feeling. The second one is self-control. Human ability to maintain self-control is reduced during an altered state of consciousness. For example, not be able to walk in a straight line. Next is time orientation. During an altered state of consciousness, time tends to be experienced at a different speed. For example, time may be appear at a speed up or slow down. Last but not least, content limitation is also one of the characteristics of altered state of consciousness. Content limitation is usually can be more or less than in normal waking consciousness. During an altered state of consciousness, the ability to pay attention on certain tasks or instructions can be decreased or increased with reduced ability to process the information and fewer limitation on content. Thank you, that's all from me.
Assalamualaikum and hi. My name is Nur Asyikin binti Mohamad Nasir. My metric number is 76169. Now, I will be presenting about importance of understanding consciousness. The importance of understanding consciousness is better recognize what happened on surrounding. As we know, brain does not produce consciousness. Brain is able to receive and transmit consciousness. But how brain can transmit and receive consciousness? Our action towards the consciousness will lead our brain works to think what we perceive. Consciousness benefit us at better in solving problem. When we conscious, we know what to do and what is the next step should we take. When we have a consciousness, we will applying our knowledge that we have to solve the problem or anything that happened around us. But it depends on what we notice and what we think about something happened. That is why everything depends on what we perceive on consciousness. However, consciousness will be applied to patients for assessing level of their consciousness, especially for coma patients or any other cases. But how doctors and nurses can assess level of consciousness of patients by using consciousness? There are many types of scales that have been designed to assess level of consciousness of the patient. For the example is AVPU scale. AVPU scale is very helpful to observe patients' behavioral response to different stimuli. AVPU stand for A. The patient is awake. V. The patient responds to verbal stimulation. P. The patient responds to painful stimulation. And the unrespond patient is labeled as U. AVPU scale is very helpful for an examination of the pupils. Doctors and nurses will be applying this on the coma patients. We can detect whether the patients are conscious or unconscious by using AVPU scale and during the examination of their pupils. Any abnormal change such as pupil size or shape or neurological signs also can be measured by a AVPU scale. This picture shows a doctor and a nurse assessing level of consciousness of a coma patient. I think that's all from me. Thank you. Let's move to the next one.
Next, the importance of understanding consciousness is people will be more aware about their health. Healthiness is the most important things in our life, but some people did not realize it. Then that is what we call the lack of consciousness. This is because people that have self-consciousness will be care about their immune system or generally their body's ability in fighting a disease. So, by having this consciousness, people will attend to do the activities that can maintain their body health, such as doing a regular exercise every day and also taking a good diet. The relation between the consciousness and the patient in the world is patient will be alert to the pain that they have and also attempt to care themselves or to treat themselves by follow the instruction that given by the doctor or the nurse and also take the medication on time so that they can be healthy again. The other example about the importance of understanding consciousness is people that go to health consultation will not disobey the advice that given by the doctor or the nurse because they conscious the consequence of the action that they take every day will affect their body healthy in the future. And also they understand the phrase that prevention is better than cure.
Hi, my name is Nur Afiqah binti Fathi. My metric number is 73673.
Me and Aina are going to present about the importance of altered states and the experience by the patient. The definition of altered state is changes in one mental state which affect their consciousness. When we talk about consciousness, it is always have relation with drugs and alcohol. So in this presentation, we are going to explain more about psychoactive drugs. Psychoactive drugs is a drugs that can alter brain activity, consciousness, and psychological process. This drug works by changing how neurotransmitters work. There are three ways of how these drugs change how the neurotransmitter work. The first one is agonist, whereby the drugs will bind to the receptor and mimic the neurotransmitter. The second one is antagonist, which is the drug will bind to the receptor and prevent the neurotransmitter from binding there. Some drugs will increase or decrease the release of specific neurotransmitter. So we come to the first type of drugs, which is depressant. Depression comes in several types of anxiety medication and painkiller. They work by inhibiting the central nervous system and slowing the heart rate and respiratory and also gastrointestinal system. This could result in feeling of relaxation, peace, and sometimes sleepiness on those who take these drugs. This drug also produce an intense euphoria. Another type of depression, it is also called as downers, whereby these drugs come in multicolored tablets and sometimes in liquid form. Some drugs, such as Zyprexa, Seroquel, and Haldol, also antipsychotics, and this drug work to reduce the symptoms of mental illness. Other depressants, such as Amitriptyline, Novotil, and Seroquel, these drugs are classed as barbiturates. Barbiturates is a drug that can use as sedative and sleeping pills. In contrast, barbiturates also help to reduce symptoms of anxiety. This type of medication usually given to the patient who suffers with anxiety. Another type of non-sedating antipsychotic drug is buspirone. It is unrelated to drugs such as barbiturates. This drug has been found to reduce the symptoms of anxiety, and it has fewer sedative or withdrawal adverse effects. This drug also has fewer cognitive and psychomotor adverse effects. Buspirone also has fewer cognitive psychomotor adverse effects, and it is usually used in elderly patients. Major limitations include lack of anti-panic activity and reduced anxiolytic effect in patients is listed. One type of depression is including alcohol. Alcohol can slow down the rate of impulses throughout the central nervous system. It also causes slurred speech, loss of concentration, and sleepiness on the drinker. The next one is hallucinogen, which is called as mind-manifesting drug. There are two common types of hallucinogen, which is LSD and THC. LSD is one of the most powerful hallucinogen drugs. It can cause one loss of contact with reality world. Things such as dreams, fantasies are very common effect of this drug. Someone with this drug will feel different emotions at the same time, plus it can alter the sense of time on someone. This drug is not addictive, but tolerance to its effect develop and last longer. And that's all from me, and I'm going to pass this presentation to Aina. Thank you.
Assalamualaikum and hi. Today I would like to continue about the previous sharing on the importance of understanding altered state of consciousness. Before that, I would like to introduce myself. My name is Noor Shamimi, Abdul Samat, and my matrix number is 73677. Without further ado, I would like to start my sharing session. So, as what you heard from the previous presenter, psychoactive drugs always have relation with altered state of consciousness. So, in this video, I would like to share more about the psychoactive drugs that have been related with altered state. The psychoactive drug that I would like to share with you are stimulants and mood stabilizer. Bear in mind that these psychoactive drugs sometimes are used to treat psychiatric patients. So without wasting time, I would like to start my sharing with stimulant, or you can say prescription stimulant. So stimulant is one of the psychoactive drugs that is used to treat ADHD, which is stand for attention deficit hyperactivity disorders. So this stimulant will help to increase the availability of the certain chemical in our brain. Hence, it will make a pathway to make it work more effective. And as I mentioned earlier, the stimulant will help to treat ADHD. So what is actually happening in the ADHD patient? So in ADHD individuals, the neurotransmitter is prematurely reabsorbed back into the neuron. Thus, that portion of neural network cannot relay the messages in an adequate and timely way. So how does stimulant help to reduce the ADHD symptom? It is by increasing the dopamine level in our brain. And how does it work? It is work by slowing down how much dopamine is reabsorbed back into the neural network. So there are some examples of stimulant that is used to treat ADHD. There are methylphenidate and also amphetamine. For methylphenidate, it will help to increase the level of dopamine by blocking the reuptake of dopamine and also norepinephrine in our brain. As for amphetamine, it will help to increase the release of dopamine and also norepinephrine from their storage sites into the synapse. So that's for stimulant. Next, I'm gonna talk about the mood stabilizer. Mood stabilizer is used to treat mood disorder characterized by intense and sustained mood shift such as bipolar disorder and also bipolar type of schizoaffective disorders. What does bipolar disorder means? Bipolar disorders mean where a person's mood change from a depressed feeling to a high manic feeling or vice versa. So these mood stabilizers are best known for the treatment of these bipolar disorders. There are some examples of mood stabilizers that is used to treat these bipolar disorders. First, we have lithium. Lithium, also known as classic mood stabilizer, and it acts on a person's central nervous system, and it is thought to help to strengthen the nerve cells communication in our brain's regions that involve in regulating mood, thinking, and also our behavior. Another example of mood stabilizer that is used to treat this bipolar disorder is called anticonvulsant medication. This medication were developed for the treatment of seizure disorders such as epilepsy. And for your information, these medications are usually not used for a person with liver disease or bone marrow or blood cell disease. So that's it from my part. I hope you will understand on what is the importance of understanding altered state of consciousness and also the effects of psychoactive drugs towards the psychiatric patient. Thank you and have a nice day.
Conclusion. As a conclusion, the nurse and the patient should have a high level of consciousness. This will help the nurse provide a better services to the patient, while patient will always aware about their health. Thus, it will make the patient recovery process become fast. That's it from our group presentation. I do hope you all enjoy our presentation. Thank you for your support and feedback. Thank you.